Hi, everyone. This is Dr. Samantha, the maternity mentor. Welcome to another live Q&A session here on our channel. We're trying to meet with everyone on Mondays at 9 p.m. Eastern Standard Time. So for those of you joining us, please remember that you can definitely put your comments and your questions in the chat, and we will try to answer them live as we get through. But in the meantime, I'm going to go ahead and I'm going to answer questions that our viewers have sent in over the past week on the channel. So let's get started with some of our viewer questions. All right, so our first question is about using antibiotics during pregnancy. So I was prescribed Zinat 500 milligrams to take twice a day for 7 days. I am 25 weeks. Is this safe to take for a cough and sore throat? So this is a great question that we have from our viewer. So the first thing you should know is that Zinat is also called cefuroxime. And this is important because some of my viewers are coming from other countries. So medications are listed under different names depending on where you are located. Cefuroxime and Zinat are safe for pregnancy, and they're used to treat bacterial infections. Now, one of the things that's mentioned in this question is it safe to use if I have a cough and sore throat? So, antibiotics will not help you if you have a viral infection. So, antibiotics only treat bacterial infections. They're designed to kill bacteria. Unfortunately, most viruses have to just run their course. The common cold, for example, is caused by a virus, which means there isn't any antibiotic that can help you. Antibiotics are often given for the common cold when the common cold causes a secondary bacterial infection, like an ear infection. So, to answer the question, is it safe to take the Zinat? Yes, it is. Will it be effective for your cough and sore throat? It depends. If it's not caused by a bacteria, it won't. Now, antibiotic use during pregnancy. If your doctor has prescribed an antibiotic for you to take, you need to take the entire course of treatment. A lot of times when we take an antibiotic, it will start to clear out an infection, and in a day or two, we feel a lot better. It's very tempting to stop taking the medication at that point because most of us don't want to take a medication when we are pregnant. We're worried about our baby. But the thing is, if you don't complete the antibiotics, it may not kill off the entire infection. And if you have some infection remaining, this may actually be more harmful to your baby. Additionally, if you get symptoms again in a couple days, you may take the same medication and now it doesn't work. And so your doctor will end up having to give you a stronger antibiotic, which might be more dangerous for the baby. So once you start an antibiotic, please make sure that you are taking the entire course of treatment. All right. So that's a good question. But short answer, Zinat is safe for pregnancy. All right, so the next several questions we have are on bleeding. We get a lot of questions about bleeding every single week. So the first question, my sister is 24 weeks pregnant and has brownish bloody discharge and has had brown discharge for weeks now. Does she need to see a doctor since blood is appearing now? So this is a great question. So the short answer is yes. If you see any kind of bleeding, whether it's brown, pink, or red, you want to contact your healthcare provider or go to the local hospital. Bleeding should not happen during pregnancy. There's only one time where we consider bleeding to be normal, and that is when you're in active labor. But at that point in time, you're being cared for by your healthcare professional, and they are monitoring the bleeding to determine if it's a normal part of labor and delivery or if it's coming from an abnormal spot. During pregnancy, you always want to contact your healthcare provider. Now, this question mentions brown discharge. Brown discharge, generally speaking, is old blood. This means at some point in time, the patient was bleeding and that bleeding has resolved. So when we see brown blood, a lot of times it's from a little tiny tear in uterine wall or the vagina or the placenta. You go to the doctor, they do a scan, they don't see anything, everything's good. They tell you as long as the discharge goes away, you're all good. However, if you see any changes that look like it's changing to active bleeding, you need to call your healthcare provider immediately. And changing from brown to red is a sign that you have active bleeding going on. Now, the next question. I'm 12 weeks pregnant and 2 days. I had bleeding last night, dark red bleeding enough to fill a panty liner. No cramps or pain. After the initial bleeding for a minute, it stopped and I started spotting brownish blood. So worried. Ultrasound shows baby is fine with a heart rate of 176. So should I be worried right now? All right. So couple things. The first thing is to get an ultrasound means that this person contacted their healthcare provider or went to the hospital. Great job. That's exactly what you want to do. Any bleeding you want to get checked out. You want to make sure somebody else on your healthcare team is deciding how you need to be assessed and getting that assessment done. So dark red blood could be a sign of an active bleed that's resolving. So that red blood's turning to brown blood, which can be a good sign. One of the things she mentions, it was enough blood to fill a panty liner. So if you're not aware of what a panty liner is, women use menstruation pads for their regular menstrual cycle. And these are usually fairly long and they're kind of thick, okay, because they need to hold a fair amount of blood from the menstrual cycle. A panty liner is thin like a piece of paper. So even though there may have been a fair amount on top of the panty liner, it couldn't have been holding a lot volume-wise. So that was a good sign that the quantity was small. One of the things she mentions is after initial bleeding for a minute, it stopped. Excuse me. So one of the things I'm going to say about this is it sounds like that could have been a trickle. A trickle is not something we want to see during pregnancy. A trickle is like an active drip or like a almost even like a like stream of blood. And that can be a sign of a very active bleed. Excuse me. Sorry, I got something in my throat. So an active bleed can be a big problem because there's very few places that you're going to actively bleed from where you'd see a trickle. One of them can be the placenta, one of them can be the cord. And if those things were to be bleeding actively, that could be considered a medical emergency. So you need to get that checked out. The good thing is it stopped almost right away. That is a sign that it is not either one of those. Now, it's hard to say what happened after that. It's important to figure out, what were you doing? Were you exercising right beforehand? Did you have sex right beforehand? Like, what else was going on in this scenario that may have caused the bleeding? Ultrasound would have been looking for something called a subchorionic hemorrhage. A subchorionic hemorrhage is a little pocket of blood that forms underneath the placenta. And the subchorionic hemorrhage could have caused that type of trickle. Subchorionic hemorrhages are usually very mild and they don't usually cause major issues in a pregnancy. However, it is something that needs to be monitored. So it's possible that's what caused it. Now, the last thing I want to mention about this question is it showed the baby was fine with a heart rate of 176. So for people who don't know, newborns have a much higher heart rate than we do. So a normal newborn heart rate at the end of your pregnancy is approximately 110 to 160. So it's very different than us adults where we run under 100. And so, but earlier in your pregnancy, the higher the heart rate will go. So 176 is considered normal for that gestational age. And I want to mention this because if you don't know what's going on and you're thinking in your head, my baby's heart rate should be 85, which is like a normal adult heart rate, then you're going to think something is terribly wrong when you hear 176. So the good thing is you got checked out. Ultrasound is the proper assessment for this type of thing. And, it sounds like it's all good. Let's talk about our next question. So, what could be the reasons for bright red spotting at 20 weeks of pregnancy with period cramps? It's about the same time I started taking Transamin, 500 milligrams, I might say this wrong, tranexamic acid, twice a day. The spotting got brown after 12 hours and then stopped. I continued Transamin for 4 days, had an anatomy scan the next day, and everything was fine with the baby. Uterus, placenta, everything was good. Doctor said to rest. If spotting gets worse, come to the ER. What could be the reason for this kind of spotting? So, spotting can happen for a variety of reasons during pregnancy. One of the most common causes of spotting is actually sex. So the hormones that are needed to sustain a healthy pregnancy, they cause the vagina and the tissue in the vagina to become like drier and coarser. And as a result, it can tear easier. So if you are having sex a lot, or if sex is particularly rough, or if you don't use enough lubrication, that can cause the vagina to tear and cause a little bit of bleeding. Another common cause of bleeding during pregnancy is a subchorionic hemorrhage. Again, this is a pocket of blood underneath the placenta. We have a video on this and we can link that in the description. So you could also have a placental issue like placenta previa. Placenta previa is where the placenta grows very close or over the cervix. So this is the cervix and this is the opening to the vagina. And your placenta is supposed to be off to the side on your uterus, but sometimes it'll grow on top. Well, if you have any kind of contractions that kind of stretch that cervix just a little bit, not really dilate, just kind of let it open a little bit of blood could come through and that could cause your bleeding. So depending, those could be many of the reasons. Now, this mom mentions Transamin, 500 milligrams. So Transamin is a medication that is used to stop bleeding. It is safe during pregnancy, and it's also very commonly used after you give birth to help prevent a hemorrhage. And so I don't think the two are related at all. In fact, the question goes on to say that it went to brown spotting after 12 hours and then it stopped. That's a sign that the Transamin was actually working. Now, the final part of this was that she mentions that her doctors told her to come back to the emergency room if she sees any spotting. So the one thing I will tell you is I would be going back to this healthcare provider and asking, why am I taking this medication? What's going on? Do you know the reason for my bleeding? Because if they are not sure and they suspect sex, well, sex is pretty benign. That's something you can call your doctor and just say, hey, I see it. If it's a placenta previa, that could be a medical emergency if you start bleeding again. So you want to make sure that you're, kind of addressing that. So again, I think you did a great job contacting your healthcare provider. All right, our last question on bleeding. So I'm 6 weeks pregnant and started bleeding today. I do have a little cramping, like a discomfort in my pelvic area and in my back, and I did have a headache. The blood is red, but has a clear discharge to it as well. I'm worried because I've previously had 5 miscarriages, and I'm really hoping this time is my time to shine. It doesn't seem like this is my typical miscarriages before, but all weren't the same. They were all pretty painful, while this one is more of an annoyance with discomfort cramping. I have yet to go to the OB due to not having one currently. So this is a great comment, and I really appreciate this viewer for sharing. So there's a couple of things with this. So 6 weeks pregnant and bleeding with a history of 5 miscarriages. This is definitely something that I'm sure she is already thinking, is this another one? So she describes bright red bleeding with cramping. Now, one of the things that a lot of moms don't realize is that you can still have a full menstrual cycle complete with cramps, everything, clots, everything, just like normal, and maintain a pregnancy. There are women who will have one final period, even though they are pregnant, and the baby will be just fine. It's possible that's this. She also describes a clear discharge, and unfortunately, that could be parts of a miscarriage. It's hard to say. Now, she mentions repeated miscarriage, and I think that that's very important here. So, one of the things you want to do is if you've had repeated miscarriages, you want to make sure that you're going in to see a specialist who specializes in maternal fetal medicine, which is basically high risk pregnancies. They can do stuff like genetic testing and other things to make sure there's nothing going on that might be putting you at increased risk for miscarriage. For example, one of the things that can cause miscarriage is something called MTHFR. MTHFR is a genetic mutation that impacts how you absorb folic acid. So, for women who have an MTHFR mutation, this means they can't take in folic acid like everybody else. And what do we all hear? Take your prenatal vitamin because that's going to help you with folic acid. And we need folic acid to have a healthy baby grow. So, if you have the MTHFR genetic mutation and you cannot absorb folic acid, you have to take a special kind of folic acid. It's called L-methylfolate. L-methylfolate is still just a vitamin. It's just kind of like a broken down version of folic acid. So the way I describe this to my patients is this. If you are regular human being walking down the street and you need folic acid, well, you have a soft serve ice cream cone and the ice cream is your folic acid, but your folic acid is protected by that chocolate shell. Well, regular, normal, average people, we can break through that chocolate shell by taking a big bite and get to the soft serve ice cream, the folic acid. For somebody with the MTHFR mutation, they can't get through the chocolate shell. It's basically impossible for them. And therefore, they might get little tiny dribbles of the ice cream that's melting down the cone, but the rest of it, it's lost to them. But what you do is you take L-methylfolate. And L-methylfolate is like having the soft serve ice cream cone without the chocolate shell. You can access that folic acid immediately, and it does help you to, be in the healthiest state for pregnancy. The other thing you want to do is by seeing the specialist related to repeated miscarriages, you may find that there's other things that you can do to help prevent miscarriage. Some women are recommended to use progesterone when they find out they're pregnant. Some providers will have you take baby aspirin. Do not just take baby aspirin without being directed by your healthcare provider, but some women, their issue is a clotting disorder, and taking baby aspirin can help. So there's a lot of things that you can investigate with all of this. All right. And for anybody who's joining us, welcome. Please make sure to put any questions you have in the comment section. Okay. All right. Our next question is about C-sections. Can I use silicone gel and silicone sheets 2 weeks after my C-section? So they're asking about silicone products for their C-section incision. So this is a great question. So let's start with basic care of a C-section incision. So after you have a baby, you usually come out of your C-section and you have a big, thick, heavy dressing on top of that. It's called a pressure dressing, and it is tight and it has a lot of tape on it. And that's to help provide pressure to prevent bleeding. Now, some doctors are not doing this anymore, but most still are. So you can expect this. That usually stays in place for 24 hours. But after 24 hours, it needs to come off because that incision needs a chance to breathe or get air on it. Also, your nurses and doctors need to look at your incision and make sure the incision looks right. So they're going to take off that tape. It is terrible. I'm just going to tell you right up front, it's not the funnest thing in the world. Just let them get it done. Very few times do I feel like ripping off a Band-Aid is the way to go, but with a C-section tape, you just want to try to get it done as quickly as you can. Ask your healthcare provider if you can help them take the tape off. That actually oftentimes helps a lot. All right, so tape comes off. You'll have a couple different types of dressings closures that may be there. You might have staples, which are exactly what you imagine. It's like a metal staple, just like stapling pieces of paper. They'll go up and down across the incision. You might have glue. This is very common nowadays. So the incision, you'll see a tiny line, and over it, usually the glue is either clear or kind of like a clear purple color. Or you may see some stitches. Usually that's the least common, but you'll see like a little bit of what looks like thread around the incision. And then oftentimes you'll see tape, also little pieces of tape. Now, if you have staples or stitches, those have to come out usually within 7 days of the C-section. A lot of times the staples will actually come out before you leave the hospital, okay? Because they want to get those out of that incision. It's just there to close it, keep it closed temporarily. Glue and tape, those stay in place and you do not touch them. The tape will start to loosen up and come off on its own while you're taking showers. So you don't have to worry about it. When they come off, you just take them off. In the meantime, you leave it alone. Now, a big mistake people make is they're afraid to wash their incision. Okay. Washing the incision is very important. Okay. Because that incision needs to be clean, just like every other part of your body, or it could develop an infection. Now, a lot of mommies, when they first give birth, right, they still have that belly. So that belly kind of hangs over like this, and your incision is inside. So when you go to clean yourself, you need to lift that belly up. Okay. You need to lift up so that you can spray water in there and then rinse it with clean water. So I usually recommend that you spray it with like soapy water and then rinse it clean with like clean water, and then you pat it dry. Okay. But if you don't lift up that overhang to expose the line where you have that C-section, this is a dark, moist area, and dark and moist is the exact right environment for bacteria to grow. And we all have bacteria on our skin. It's natural, it's normal, but we want to make sure we're rinsing it off of that area. Now, if you're a bigger woman, I personally recommend that you clean the incision 3 to 5 times per day. This is, you do not rub it. You do not rub it. You just rinse and pat dry. Okay. No lotions, no powders for at least 2 weeks. And this is where we come into this question. Can I use silicone gels? So at 2 weeks post C-section, I would not. In fact, most of the time you need to wait for the full 6 weeks, because that incision, remember, that incision went all the way into your belly to get your baby out. So all those layers have to heal. And if any of that silicone is able to enter into the body, that could cause an inflammatory reaction or an infection that might make things worse and prevent healing. So you want to let everything heal completely, which is usually about 6 weeks post surgery. After that, though, silicone is extremely effective at reducing your scarring and reducing keloid scarring. So it is something that you can use once that full healing process has happened. And then finally, no matter what you're doing, if you are applying anything to your C-section, make sure you're washing your hands first, okay? Because our hands are the biggest sources of infection out of everything. So wash your hands before you start dealing with your C-section incision. All right. So our next question is about drying up breast milk. So my baby is 2 months old. My milk supply is very, very low. I'm feeding packet milk to him, which I'm going to assume is formula. However, I feed breast milk once every 2 days. If I'm not feeding breast milk, my breasts are painful. I feel it's not sufficient for him and he keeps on crying. I want to stop my milk. What should I do? Please help. Thank you for asking this question. This is a great question. So, first thing, if any of my moms who are potentially partially breastfeeding, you can breastfeed however you want to. As long as you're supplementing with formula, if you wanted to breastfeed once a week, you could do that. Just so you know, you don't have to feel bad. Your baby still gets all the benefits of breast milk. However, it's very important that if you want to dry up your breast milk, you're able to do so. So the first thing is that you want to make sure that you are not stimulating the breasts. So the first way you can do that is you want to go ahead and wear a bra 24 hours a day, 7 days a week. Now, it's a bra, not binding. So binding is where you take like a piece of cloth and you tie it tightly around the breasts. That can actually cause clogged ducts and abscesses in the breast. You don't want to do that. You need to allow for some flow within the breasts themselves. A bra, though, helps keep your breasts in place, and that minimizes stimulation. Next, when you're taking showers during this time, you want to make sure that the warm water is hitting your back, but you don't spend a lot of time with warm water on your breasts. Warm water will stimulate breast milk flow and breast milk production. Now, if you are like to take baths, you want to, again, try not to submerge your breasts in warm water for too much time because that can stimulate breast milk. You want to use cold. So the first thing that's all natural is cold cabbage leaves. Get a head of cabbage, cut it up, wash all the leaves, and stick them all in your fridge. And every hour, put on a new set of cabbage leaves. The chemicals in cabbage will help to dry out your milk supply. And this has been used for hundreds of years by women. It's real. It actually works. As soon as the leaves are wilted, you just take them out and throw them away. Then you can use ice. So ice can be used up to 4 times a day for 10 to 15 minutes on your breasts. Ice helps to reduce milk production, okay? The biggest thing when using ice is you need to make sure you have a cloth between your skin and the ice so you don't hurt yourself. Now, there are some homeopathic herbs like peppermint that you can use that can help you to dry up your milk supply as well. So peppermint tea, peppermint candies, those can all help. And then finally, if you are really struggling with this, you can ask your healthcare provider if you can take an over-the-counter allergy medication such as Benadryl or Sudafed. Sudafed is the one I prefer the most. Sudafed can help to dry up your milk supply because what is Sudafed designed to do? It's designed to dry things up. People use it when they have a lot of secretions due to their allergies, teary eyes and stuffy nose. Well, it will dry that up. It has a side effect potentially of drying up other things like your breast milk. So the thing with Sudafed is that Sudafed can cause increased blood pressure. It can cause your heart rate to be higher, and it can cause you to have trouble sleeping, insomnia. So you want to make sure you check in with your healthcare provider who knows your entire health history, and they know whether or not it's safe for you to take Sudafed. Okay. But that's absolutely a thought for you. Okay. All right. So our next question is about formula feeding. So, do I need to boil distilled water before I mix with my baby's powdered formula? So, this is a great question, and the answer is no. Distilled water does not need to be boiled prior to use. In fact, most waters do not need to be, as long as it's coming from a safe water source. Now, if you do decide to go ahead and you decide to boil it, that's fine. A lot of people choose to do it because they want to make sure that it's safe for their baby, and so they go ahead and they do that. Now, one of the things you can also do, and a lot of parents like to do this to help make this process a little bit easier, they will prepare the water however they're going to prepare it, whether it's boiling it or not, or just heating it up, because some people want to heat up the distilled water so that it's warm for the baby, and they put it into a thermos that will keep it warm for 12 hours. That's a really convenient way to get your water done all in one shot in the morning, and then you have it all day to prepare your formula bottles. All right, so our next question. I had 3 abortions because of cervical incompetence. I am losing hope. In the 3 cases, I went with cervical stitches and an intake of progesterone and still phased preterm delivery. What should I do? So thank you so much for sharing this with us. This is a very challenging and difficult subject for a lot of people. So the first thing I want to address is the term abortion. I don't want to get too heavy into it, but abortion, depending on where you live, that word has a very negative political association. However, in the medical field, we use the word abortion to describe the loss of a pregnancy. And a miscarriage is considered a spontaneous abortion. So I just want to clarify from the beginning that it sounds like this viewer was having spontaneous abortions or miscarriages caused by an incompetent cervix. Okay, what's an incompetent cervix? So you have your uterus, okay? And at the bottom of your uterus is your cervix. This is the opening that goes down to the vagina. The cervix is supposed to be closed. It's supposed to be long and it's supposed to be thick. Okay, this is what a normal cervix should look like during your pregnancy. At the end of a full-term pregnancy, this cervix will eventually thin out, open up, and allow a baby to come down through. Okay, an incompetent cervix is a cervix that starts to open, thin, and move out of the way prior to a baby that's supposed to be born. So prior to 36 weeks, basically. Okay. Now, in this viewer's case, she is having an incompetent cervix prior to 20 weeks of pregnancy. Babies aren't able to live outside of the uterus and the body until they're about 22 weeks of gestational age, and that's pushing it. Most of the time, a baby needs to be 24 weeks, and babies born at 24 weeks can still have significant issues associated with that delivery, okay? So prior to 20 weeks, though, an incompetent cervix, the cervix is opening up and allowing the baby to pass through without, with uncontrolled. A cerclage is a cervical stitch. So you take the cervix that's starting to open and you basically stitch it, literally like a thread, around and through to close it up and keep it closed. Now, this is not a guarantee. Unfortunately, even using a cerclage, it does not mean that that will stay in place and prevent the cervix from dilating. It sometimes can. The other thing is getting a cerclage has risks. It is a procedure. It requires anesthesia. Most of the time they do an epidural, but sometimes you'll need to get like IV anesthesia. And then second to that, your water can break. So I have taken care of women who opted to get the cerclage. And after the cerclage procedure was done, we usually monitor you. We do expect a little bit of bleeding. That's considered normal. And very quickly after that, their water has broken. The amniotic sac has broken. And at that point in time, the baby cannot survive anymore without that fluid. And so unfortunately, that's considered a spontaneous abortion and the mom miscarries. So these are things that can happen. So depending on the situation, these may have been some of the things that happened in this person's case. Additionally, you can get infection because people are up inside, messing around with stuff. They're doing it for a reason, but they are up there and that can cause infection. Now, one of the things that she says here is progesterone. Progesterone our progesterone medication is often given for women who have multiple miscarriages. You need a lot of progesterone in the beginning to sustain a pregnancy, and that's why this was given. Now, when you've had multiple miscarriages, again, like I said previously, you want to go to a specialist to get some things checked out. With cervical incompetence, one of the things that you need to make sure is that you have very clear guidelines from your healthcare provider, the activity you can perform. Okay. Some women can run marathons and do cartwheels and go on roller coasters and do all sorts of stuff that really we're not supposed to do when we're pregnant, and they do it just fine. And they have a completely healthy pregnancy. And other women really need to take it easy. Now, taking it easy does not mean complete bed rest, but it does mean you might have to change your job if your job right now requires you to stand on your feet a lot. It might mean that you need help with your other kids if you get very stressed out easily. You definitely want to make sure you're drinking plenty of fluids. One of the causes for cervical incompetence is silent contractions. So again, you're supposed to have a cervix that's long, thick, and closed. When we have contractions at the end of our pregnancy, what the contractions do is they start to pull at the cervix, right? And over time, the cervix stays open, allowing for a baby to come down. If you have, so at the end of your pregnancy, you can feel those. That's why we all hear about it. Labor is so painful and all that stuff. But some women, especially early in their pregnancy, can have silent contractions. So these contractions are doing the same thing as those contractions at the end of a pregnancy. They are pulling at the cervix and causing it to open and dilate, which can allow the baby to pass through. So you want to determine whether that's happening. And one of the most common causes of contractions during a pregnancy, other than true labor, is dehydration. So if you are having an incompetent cervix and it's unclear what's causing it, you want to make sure that you're drinking plenty of fluids. It's going to be good for you anyway. It's going to be good for baby anyway. It really is such an easy way to try to prevent this. All righty, let's talk about our next one, nausea. I'm here because I'm experiencing nausea. I'm 36 weeks and this is my first pregnancy. Why is this happening and what can I do? Well, congratulations for being 36 weeks pregnant. You're almost there. You got 4 more weeks to go. So nausea can happen at any time for a variety of reasons. However, nausea at 36 weeks of pregnancy could be a sign of early labor. So one of the things a lot of people don't realize is that our body right before labor, one of the most common signs is vomiting and diarrhea. And the reason for that is your body wants to clear out the intestines prior to labor really getting going, because honestly, your intestines, that's where your poop is. And if they're full of poop, if you've been constipated and poop is just sitting in there, that can actually kind of push on the vaginal canal where the baby's supposed to come out and actually make that space smaller. So your body kind of knows this and wants to get everything out of the way so that the baby will be able to come out very naturally. And so as a result, you'll often find that women are having these symptoms ahead of time to kind of clear, that's your body's way of clearing everything out. Nausea is also common during labor as a sign of transition, as a sign that the cervix is doing something big. So this mom could be experiencing a significant amount of contractions and not really realize it. And in fact, she is actually dilating, and that could be causing it. Now, the other thing is that, at 36 weeks pregnant, you got a big giant baby who's running out of space and is able to sit up against the stomach. This can make the stomach smaller, but the stomach has a tube that goes down to like the small intestine for digestion. If the baby's kind of squishing up against that tube, right, not allowing the food to kind of pass through the stomach quickly, and therefore there's food kind of sitting in the stomach, that could also make you feel nauseous. So there's a variety of reasons. So what can you do? So, mild nausea, I usually recommend ginger. So you can eat real ginger. A lot of people eat real ginger root, or they make ginger tea. using real ginger root. You can also get some of the prepackaged ginger tea, or you can use ginger ale, which is a soda using ginger. Another thing is vitamin B6. Vitamin B6 is amazing for nausea, and it's something that can be really helpful. And you can combine that with Unisom, which together makes a medication called diclegis, and that is extremely helpful for nausea. But if you are experiencing nausea at 36 weeks pregnant, you do want to let your healthcare provider know what's going on, because they may want to assess you and just make sure you're not dilating. If you want more information about kind of homeopathic cures for nausea, you can check out our morning sickness video. So I've got a question in the chat. Thank you. Hi, I got spotting at 17 weeks after intercourse for 1 day. The scan came back saying I have a low-lying placenta, less than 2 centimeters. 20 weeks again, bright red spotting. And I started transamine twice a day. Spotting stopped after 16 hours. The anomaly scan said no more low-lying, only an anterior placenta. Okay, and baby is healthy. What can be the reason for spotting with cramps? Doctor didn't give me any reason. Okay, this is a good question. It has a couple things in it that I like. So I'm just rereading it as I'm looking at it. Okay. So 17 weeks pregnant, and after intercourse, there's spotting. So if intercourse is enjoyable for a woman, she will hopefully have an orgasm. Orgasm causes the uterus to contract. Okay. So when it contracts, it will cause a little bit of pressure on the placenta. And in her case, she had a low-lying placenta. So probably when there was that little bit of pressure, it caused that placenta to kind of squeeze a little bit like a sponge, and it squeezed out a little bit of blood. Now, what is a low-lying placenta? Uterus, cervix, or cervix is at the bottom. Normally, the placenta should be like way up here on the side of the uterus. But sometimes our placenta ends up being low, down here near the opening. Now, if it's over the opening, that's called a placenta previa. This is a very serious condition that is monitored very carefully by your healthcare provider, because if you have a placenta previa, you have to deliver by cesarean section, and you cannot dilate at all, because if you dilate, you will start to bleed. So a low-lying placenta can sit right next to that. And so again, if you had an orgasm or just having sex in general, can cause a little bit of like uterine irritability or contractions. And that can cause that cervix to stretch a little bit, which caused a little bit of bleeding to come out. Transamine is the medication. We actually talked about it a little bit earlier with another question. That is given to help stop bleeding. So that's perfectly a great, treatment. And then what I see is that at 20 weeks, it happened again, and there was bleeding, and they were put back on it. Now, the scan said no more low-lying, only an anterior placenta. So what does that mean? So our low-lying is no longer. Well, how did that happen? As the baby gets bigger, the uterus gets bigger, okay? And that placenta will sometimes migrate or move as the uterus gets bigger. So in her case, it probably moved away from the cervix. Additionally, anterior, just so everybody knows, anterior is front of the belly, posterior is back of the belly. So her placenta is just up front, okay? So baby is healthy. What could be the reason for the spotting with cramps? To be very honest, again, it could just be sex and a tear in the like the vaginal tissue. It could be that the placenta was still a tiny bit low-lying. Ultrasound is not perfect. It's great. It's way better than what we used to have. It's improving every day. But it is possible that placenta is still a little bit low-lying, and that's what's causing it. It could also be simply that you had a subchorionic hemorrhage, which is that little pocket of blood underneath the placenta that ended up having a little bit of burst. It's hard to say. The most important thing, though, is that the baby was doing well. The transamine, again, for 4 days, very safe for pregnancy, a really good call. Progesterone 10 milligrams twice a day for the next 5 weeks. That's also good. So the one other thing I would tell you is to talk to your healthcare provider about if you need any activity limitations, because maybe some of this has to do with strain. Okay. Maybe you can't be lifting heavy boxes or lifting the groceries, that might be stretching things inside and causing a little bit of spotting. Some women also will have contractions due to dehydration. So you want to make sure you're staying hydrated, because again, if you're having any kind of contractions, even if you don't feel them, it will cause some uterine irritability, which can cause you to bleed a little bit. Thank you for the question. That was great. All right. Next question. If you have sex every month and get pregnant every month, is it dangerous to the other babies when the first baby is born? Won't the other baby still be in development if you get pregnant every month? So one of the reasons why I love this question is it talks a lot about something that I think we don't address enough, which is which is women's health and pregnancy. So once you are pregnant, you cannot get pregnant again. There are very few cases that this can happen. And the most common way a woman could get pregnant twice with 2 different babies at 2 different gestational ages is a woman who has a bicornate uterus. So a bicornate uterus is extremely rare, and it basically means you have like 2 uteruses. Okay. That is theoretically possible. It's like a 1 in a million, 1 in 3 million chance. Once you are pregnant, you stop ovulating. You stop releasing the egg that allows for the sperm to enter to create a baby. And that happens so that the baby that's there can grow in and develop into the uterus and do all the things that it needs to do. So, because you're right, if we were getting pregnant every month, that would be harmful to other babies. So the answer is, what happens? Nothing happens, because you cannot get pregnant after you are already currently in a pregnancy. Once you have delivered your baby, then you can become pregnant again. All right, so I have a question. Pregnancy with epilepsy. So this is a great topic. So if you have epilepsy, this means that you have a condition where you can have seizures. Most of us, when we think about seizures, we think about grand mal seizures, which are the big seizures where you're shaking, you can drool, you might use the bathroom on yourself. A lot of people will fall to the floor. Some people will have an aura ahead of time. This means they might see, hear, smell, feel something ahead of time that says, I'm about to have a seizure. A lot of these people are born with epilepsy. Some people, they will develop it after a traumatic brain injury or a fall or something like that. So for people that have grand mal seizures, they're usually put on a medication to prevent the seizures. These medications are oftentimes contraindicated for pregnancy. So what that means is that they are known to cause birth defects and interfere with having a healthy pregnancy. Now, the thing is, if you have seizures without your seizure medication, you might have seizures and you potentially could die. So what does a woman do? So there are a ton of medications for seizures. There's a wide range, and certain ones are far safer than other ones for women who want to get pregnant. So an example of a very unsafe, no-go, shouldn't use medication is Depakote. Depakote has been used forever. It's also called valproic acid, and it's used for seizures. Depakote interferes with your ability to absorb folic acid. Folic acid is needed for a healthy brain and healthy spine of a developing fetus or baby. So you can't take Depakote if you're trying to get pregnant or are pregnant. It really can cause serious issues and most likely will end in a miscarriage. One of the medications we use oftentimes and try to switch women to if we need to keep them on an anti-seizure medication and allow them to be pregnant is Lamictal. Lamictal has been shown to be extremely safe during pregnancy. And while it holds a risk of birth defects like most of them, it has a far lower risk profile than some of the other ones. Some women will choose, under the guidance of their neurologist, to come off of their medication and try to get through the first trimester without medication. I do not recommend this unless your OBGYN and your neurologist are both on board and working together and you're having very close follow-up. And by close follow-up, I mean that you are seeing your providers every single month during this time period. Additionally, you should not be driving a car if you have chosen to be off of your medications in order to get through, say, the first, 3 or 4 months of your pregnancy, because you could have a seizure at any time. That would put you, the baby, and other people in danger. Now, pregnancy and epilepsy. The other thing we need to worry about is whether you are at risk for having seizures later on. And one of the biggest things that can cause a woman to have seizures later on is preeclampsia, which is uncontrolled high blood pressure and organ failure. And preeclampsia is a very serious condition. And actually, we're going to be coming out with a video on this very soon. And if it's left untreated, it can lead to eclampsia, which is seizures. We need to avoid a mom having seizures in her pregnancy, because when a mom has a seizure, it stops blood flow to the placenta and therefore to the baby. And that can be life-threatening for baby. When women present and the baby is greater than 22 weeks of age and they're having active seizures, we deliver the baby immediately because it's a medical emergency for the baby. One of the things that we also have to do when we're looking at medications is, for example, a medication that's commonly used for depression is Wellbutrin. And Wellbutrin can actually increase the risk of a mom having seizures during her pregnancy. So you want to be taking those away. No matter what you're doing with seizure medication and seizures for a pregnant woman, you need to make sure that all the medications are being titrated, tapered very slowly or quickly, depending on the medication, and being monitored by a maternal fetal medicine physician. This is a doctor who specializes in high-risk pregnancies and is able to monitor both your physiological state and the baby's. That's a good question. That's an excellent question. All right, STDs. So, which is sexually transmitted diseases. Is it possible to pass genital herpes to a fetus? If so, what are the chances, and what happens if herpes is passed to the fetus? Is it possible to deliver a healthy baby when the mother already has genital herpes? So, you can absolutely deliver a healthy baby if you have genital herpes. The biggest thing with herpes is, are you having an active outbreak or do you have it passively? So many women will be diagnosed with herpes and they have the one outbreak that gives them the diagnosis and they get treated and then they go for years without any symptoms. They still have herpes. Herpes, once you have it, and most people have it. An active outbreak includes lesions, which are like sores on the vagina. If you have active herpes lesions at the time you go into labor, you need to have a cesarean section. If you do not, the baby can develop herpes, which can translate into a life-threatening condition for the baby, and the baby can die. So when we know there are active genital herpes lesions, we deliver a baby via C-section, period. It's done. Okay. If the mom delivers by like, say, an emergency, she delivers in a car, and we figure out that she has active genital herpes lesions, the baby is usually transferred to a neonatal ICU, where they monitor the baby and give the baby antiviral medication, because genital herpes is a virus. It's not a bacteria. And they go ahead and we monitor the baby and make sure the baby's going to be okay. If you have no active lesions at the time of your delivery, you're fine. You're good. The baby should be fine. There's no reason to worry. For a lot of women, your doctor may have you start taking an antiviral, usually it's Valtrex, around 36 weeks of your pregnancy to help prevent you developing active lesions and allow for you to have a natural childbirth. So this is a very good question. All right, urinary tract infections. I am 31 weeks. When I pee, I feel burning and pain. What could be causing this? My urine was negative when my doctor checked. I don't understand. So sometimes we can have a urinary tract infection that is subclinical. This means you have all the symptoms, but you don't actually test positive on a urine culture. The best thing you can do is just drink. A lot of people swear by cranberry juice. Now, we're not talking like the cheapy, full of sugar stuff. We're talking about all natural, organic, no sugar added cranberry juice. Now, there's research that says it can help with urinary tract infections. There's other research that says it doesn't make a difference. As long as you don't have gestational diabetes, which means you should be avoiding stuff like juice, drinking that cranberry juice may or may not help you a little bit. And it's certainly increasing your fluid intake, which is necessary. The more you pee, the more you can pee out any urine that is sitting in that, any bacteria that's sitting in the bladder that might cause the UTI. Now, you want to talk to your healthcare provider and make sure if you have any kind of discharge, any other kind of discharge, clear, white, anything, you want to go ahead and ask your healthcare provider to examine you and possibly swab that discharge to see if maybe you have an infection in the vagina that is causing that irritation when you pee. Another question I have on UTIs. In my urine test, there are epithelial cells and pus cells. The doctor suggested Uricane K syrup. Is it safe for use in my pregnancy? So epithelial cells are skin cells. That usually happens when you don't clean yourself good enough during the urine test. So urine test, they give you a cup and they give you a wipe. You should wipe from front to back and you want to wipe really good. Then you pee just a tiny bit into the toilet. You want to just like throw it away. And then you place the cup underneath and you collect urine. And then that urine they test. Now, if that's not done exactly right, epithelial cells can happen. It's just considered like normal stuff. Pus cells are a sign of infection that usually means that you have a urinary tract infection that needs to be treated. Unfortunately, uricane is not something that is used in my area, so I cannot comment on whether it's safe or not for pregnancy. However, what I will tell you is if you're ever concerned about something your healthcare provider has told you to use, go to your local pharmacist. So pharmacists are also trained in medications and they know what medications are safe for use during pregnancy. So pharmacists are an excellent resource for moms to go to if they want a second opinion on whether something is okay for them to take. All right, we're wrapping up here. Please, if you have any comments, let me know. This is our last question for the night. I am 30 weeks pregnant and I can't sleep. My stomach is in pain. My vagina is discharging a white, smelly discharge. What could be the problem? All right. So this comment was made on my yeast infection video, which is a very appropriate place because yeast infections usually have like a white, chunky discharge. But yeast infection discharge is usually not smelly. So one of the things that I would tell you is if you ever have any kind of discharge, you want to let your healthcare provider know so that they can assess you. The proper assessment is really to take a sterile swab, which kind of looks like a Q-tip, a cotton tip swab. They take a little bit of that discharge and they send it to a laboratory to test it and see what kind of discharge it is. Now, stomach pain and having trouble sleeping because of it, this is a concern. At 30 weeks pregnant, we have a very big baby at this point. If you're having stomach pain, you want to go to a hospital if you can't reach your healthcare provider because you might be in labor, you might have an infection going on, there might be something else. Stomach pain is a no-go. This is not normal during pregnancy and is something you need to get investigated right away. Now, remember, your healthcare provider is available to you 24 hours a day, 7 days a week. This is what OBGYNs and midwives sign up for. So you need to call. If you have any questions, please call them. That's what they're there for. If you're unable to reach them, you want to go to a hospital to get checked out and make sure you and the baby are okay. A hard, rigid stomach, like hard like a rock that does not stop, is a sign of an infection or possibly a bleed, and you want to make sure you get that checked out in a hospital. That's considered a medical emergency. As far as what to use for this, it's hard to say. It says what could be the problem. It could be a yeast infection, but the fact that it smells, to me, it just sounds like it's probably some kind of bacterial infection that needs to get treated. And usually it's treated with antibiotics. All right, so that completes all of the questions that we received from our viewers this week. I am so excited to be here to answer your questions. Please remember to join us on Mondays at 9 p.m. Eastern Standard Time. I love seeing you all. I love hearing from you all. We're here to answer your questions. We do have some new videos coming up, and, we look forward to helping you all out. So thank you so much for joining us. My name is Dr. Samantha. I'm the maternity mentor, and I want you guys to have a great night. Have a good one. Bye, guys.